my name is Savannah Banks. I'm a junior nursing student, and I'm filming Emily Shearhart on checkoff for head, neck, and lymph nodes.
Hi, Mr. Dwelly. My name is Emily. I'm a Liberty University nursing student. I'm going to be assessing your lymph nodes, your head, and your neck today. And I have completed hand hygiene as well as I would wear gloves, but today I'm not going to do that. And when assessing lymph nodes, I would assess for size, consistency, pain, as well as location, character, mobility, symmetry, pulsatile nature, vascularity, and temperature. Okay? And if there were lymph nodes palpable, I would assess for their visibility, their position, as well as their, if there is any edema present or arrhythmia. Okay? I'm going to go ahead and palpate your lymph nodes, okay? All right. Occipital, postauricular, preauricular, carotid, retropharyngeal, submandibular, sublingual, and submental. And on the left side, posterior cervical chain and anterior cervical chain, as well as a deep cervical chain. And on the right, posterior cervical chain, anterior cervical chain, and deep cervical chain. And the supraclavicular. And there are no lymph nodes palpable, which is very good. And I would also palpate the axillary, epitrochlear, and inguinal lymph nodes, but today I'm going to bypass that. I'm going to defer that. Okay? And moving on to, and is there any tenderness with the lymph nodes?
No.
Okay, good. And I'm going to move on to the head. Okay? The head is upright, it is midline, it is normocephalic, it is atraumatic, and there is no signs of involuntary movements, tremors, or tics, which is good. All right, and I'm going to assess the face now, and facial features, including the eyebrows, the eyes, the nasolabial folds, and the mouth are all symmetrical while still and while he is moving. Okay, now I'm going to palpate your sinuses, okay? All right, frontal, maxillary, and the mastoid process. Was there any tenderness with that? Okay, that's good. All right, now I'm going to assess your scalp. Okay, all right. The scalp is freely movable without any lumps, bumps, lesions, or indentations, and there's no signs of seborrhea or infestations, and this is symmetrical bilaterally. Okay, all right. Now I'm going to assess your facial sensation with, and that is cranial nerve number 7, which is trigeminal. Okay? All right. Will you go ahead and tell me whether this is sharp or dull? Okay? And close your eyes. Okay?
Dull.
Okay? And sharp.
Sharp.
Okay. All right. So that's dull and sharp. Now you can tell me which one they are, okay?
Dull. Sharp. Dull. Sharp. Dull. Sharp.
Good job. And again, this is cranial nerve number 7, trigeminal. Okay. Now I'm going to assess the strength of the masseter muscle. Can you open your mouth? Okay. And jut it to the side and to the other side. Okay. And jut it out front. And pull it back. And clench your teeth. Okay, good. Now open your mouth against my resistance. And to the one, there you go. And also to the right side with my resistance. Good job. Okay, and again, this is testing, again, cranial nerve number 5, which is trigeminal. Now I'm going to assess cranial nerve number 7, which is facial. And I'm going to do this. Will you follow me, okay? All right, can you purse your lips and puff your cheeks and frown and smile without your teeth and smile with your teeth, okay? And tongue in cheek. Okay, good. And now can you leave your eyes closed, and I'm going to try to open them, okay? All right, good job. And can you raise your eyebrows for me? Okay, good. And the raising of the eyebrows is symmetrical bilaterally. Okay? And I think that's it. And again, this was cranial nerve number 7, facial. Okay? Now I'm going to assess the neck. Okay? Can you swallow for me? Okay. The patient swallows without any trouble, and the trachea rises and falls midline. There are no visible lumps or protrusions. There is no distension of the jugular vein or the carotid arteries, and there are no lymph nodes visible, which is very good. Okay, I think that's it. All right, now I'm going to go ahead and palpate your neck. Okay. 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 There are no bumps present. Okay. And I'm going to go ahead and palpate your thyroid, okay? Okay, you lean forward a little bit. I'm going to put your hands around your neck. I'm not going to hurt you, okay? And I'm going to push it to the side, okay? And to the side, okay? And upon palpation of the thyroid, it is soft, it is not hard or firm. It is symmetrical on both sides, and it has no gritty sensation, and it is not enlarged. Okay. All right. Now I'm going to go ahead and test your range of motion, as well as your the strength of your sternocleidomastoid. Okay. And when testing for the strength of the sternocleidomastoid, this is assessing cranial nerve number 11, which is spinal accessory. All right. Okay. Go ahead and turn your face like this, and turn your face like this, and turn it to the side, and to the other side, and go down, and up, and back, and down. And go ahead and shrug your shoulders. Okay. And patient's range of motion is good, as well as neck symmetry while in motion. Okay. Now I'm going to go ahead and test for the strength of your sternocleidomastoid. Okay. All right. Go ahead and press down. Good job, and press back. Good job. And turn your head to the side against my hand. And again on that side. And turn your head to the side. Okay? And again. All right. The strength of the patient's sternocleidomastoid is good. Okay? Okay. I'm going to go ahead and have you swallow while I'm palpating. Okay? Good job. And one more time. And while assessing the patient while swallowing, again, he has no trouble swallowing, and there is no deviation or tugging of the trachea, which is very good. Okay. I believe that is it. Okay. Now I'm going to go ahead and palpate the temporomandibular joint to assess for crepitus. Okay. Open and close and clench your jaw. Okay. When assessing the temporomandibular joint, there is no crepitus, popping, or cracking. Okay. Now I'm going to go ahead and auscultate your temporal arteries, your carotid arteries, as well as your thyroid. And there were normal pulsatile sounds heard as well as breath sounds, but there were no bruits heard. Thank you.